Welcome back to PsychFM. In commemoration of World Maternal Mental Health Day, we are joined by Dr. Annabelle Chow and Christine Kwek, clinical psychologist, as they discuss perinatal mood and anxiety disorders.
Hey Chris, that day I was having lunch with a group of my friends, and then one of my friend's husband pulled me aside and just kind of like gently asked if I thought that his wife had perinatal depression. Has that happened? Like, have you had conversations like that with friends before?
Yes, I think so, but not really asking about depression, but like asking also about what are normal symptoms that maybe pregnant women experience, because I think it can be quite similar actually. What was your response to him?
So, I first asked him like what he was concerned about, why he thought, my friend, his wife, met diagnosis and what's been happening, if they needed help. So he was listing some of the things, and I did get a bit concerned. So like he mentioned that he was finding that she was not really sleeping very much, and she was up a lot, like being very anxious and having like very recurring, like repetitive thoughts about she's not going to be a good mom. She thoughts that she might kill her own child, and there was also a history of a miscarriage, so they were really worried about whether they could carry the baby to full term, and then what would happen, whether the baby would be healthy. So there were like just predominantly a lot of these thoughts that she couldn't sleep, and it was affecting her appetite. And it didn't really help, right? Like, I don't know about you, but first trimester, oh my God, I was vomiting so much. So she is as well. And so she's really severely quite like under nutrition, right? And then she's not eating well because she's very anxious. So I think it's a bit concerning.
Yes, I was also sharing with one of my friends who had concerns about her friend who might have similar symptoms, and they suspect that she might actually have perinatal depression, mood anxiety issues as well. So the things that they observed were, for example, she had difficulties concentrating at work. Most pregnant women also get very tired and they have difficulties concentrating. They are always exhausted. But something a bit different with this, with their friend, is that she also started to isolate herself. So she was keeping a lot to herself. And she also shared some anxiety of her not being able to take care of her child when the child is born.
So there's a lot of crying also.
Yes, there's a lot of crying, more than usual, I think, because usually pregnant women got a lot of hormones, right?
Yeah. Correct.
So, but more than usual.
Yeah. So I find that also like a lot of more intense emotions over a more regular, frequent time period, and it actually really affects their functioning. So like for the rest of us, right, if we don't have perinatal anxiety or depression, we can generally still function, unless there's a medical reason. We can still go to work, we can still look after our other like older kids and do the things that we need to do. But I think when you are diagnosed with it, it really affects your ability to carry out your everyday activities. Sometimes it's really hard for them to get out of bed. Sometimes it's really hard for them to participate in any kind of social activities.
Yeah, so even having conversations like that can be very difficult for them. So it's quite similar to individuals with just typical mood anxiety issues as well. So it's not very different. But I think what is a little bit more different with perinatal mood anxiety issues is that they have specific thoughts and worries about their unborn child or newborn child.
Yes.
Because this can take place until about a year after the child is born.
Yeah. And I think a lot of it is also related to the pregnancy itself, or like related to childcare or like parenthood, right? And if they have like a history of being brought up in an environment where it wasn't too healthy, where the parents, one or two were both very neglectful or abusive. I've had quite a number of patients who come in and they have a lot of anxiety about becoming moms themselves, and they're worried that they will carry on the intergenerational trauma. I've also got patients who've like expressed, if they've had themselves or their friends had miscarriages or had a lot of difficulties conceiving, then there's a lot of anxiety about this pregnancy, or if they've had a very traumatic like birth before, then I find that the anxiety goes up quite significantly.
Yeah. So I think with COVID, it actually increased a lot of anxiety for pregnant women also, because the fear of getting COVID and then not being able to deliver your child with the support of your loved one, I think that increased a lot of anxiety among pregnant women. I personally knew 2 friends who actually delivered the baby on their own.
Oh, add one more from my side.
So that was very, very sad for them. So I think this is it's still a fear for a lot of pregnant women out there.
I think also the fact that, I remember when I was pregnant, I was very concerned that I fell sick, any type of sick, right? Because I didn't want to take medications, because I was worried about the impact of medications on my unborn child. So I refused to take any kind of medications. And I actually remember this, I had an unrelenting cough for months.
Okay.
Finally, I relented. I took the medications and it stopped. But I can imagine, with COVID and all that, just thinking about how that would have an impact on your health or your child's health will itself be quite anxiety provoking. Or even I've had patients who shared with me where they have a family history of a blood disorder. They're very concerned that their child might have it. So you don't really know sometimes. You can't test for everything until your child arrives. So I always remind my patients there's kind of a healthy normal of anxiety, right? Because there's a lot of risk in pregnancy, in carrying a child. But then there's also that, overtly intense anxiety that affects your everyday functioning.
So actually the other thing that people neglect is the fathers. So fathers get neglected because they keep to themselves a lot. They don't like to share about their emotions. Most of the time they're also dismissed. And I'm not familiar with the numbers you mentioned earlier.
More than 10%. So actually more than 10% of fathers meet criteria for paternal postpartum depression and anxiety disorders, but they don't receive as much attention and help than maternal, postnatal and perinatal anxiety and depression.
Because fathers are always on the run actually, so they will take care of all the physical needs. They will go and get the groceries, they just care for the child, and then I think and they don't even have the time to realize sometimes that they are also struggling.
I think also there's a lot of lack of knowledge or attention that this is what they might actually be experiencing, because I think there's a lot of education or more education on maternal health when it comes to perinatal and postnatal depression, right? But when it comes to fathers, it's almost like, you're expected to just be okay, but some fathers actually can have quite intense feelings and feeling like this huge responsibility on them now to look after their wife and their child. And that might, if we don't pay attention to the caregivers, then if they burn out or if they are not well looked after, they can't look after the mom and the baby also. So I think some attention needs to be placed there.
So I actually hear a lot from fathers that they feel very helpless and useless when mummies are pregnant, because they are not carrying the child and then they cannot control anything that the child is gonna, or what's gonna happen to the child.
I feel like that gave me a memory. I remember when I had my contractions when I was in labor. Oh my god, they were the worst pain ever in my life. And I mean, my husband was just helpless. And I remember he actually told me that he got some PTSD symptoms because he could remember, when he was going to sleep, he could remember exactly the image of me being in so much pain, but he couldn't do anything. There was nothing he could do to alleviate my pain. In fact, anything he attempted to just made me more irritable, because you are the reason why I'm like this.
I'm dirty also.
Yes. But then it actually affected his mood, and he actually became very more hypervigilant, and he had these flashbacks, even after baby arrived. So, but there's no time to talk about his experience, because when the baby arrives, he's talking about the baby, he's talking about the mom. So I think there's some work there's some attention that we need to put.
Actually, on that note, not true, I think, because my experience with my gynae was pretty good. She actually checked in on my husband when I was delivering. So she checked.
Wow.
Yeah, she checked and I was like, "Are you okay?" And then offered him like a glass of water, and then there I am thinking like I'm the one in pain. But yeah, she did. Yeah, so she did check in on my husband.
Okay.
So I think physicians whom you have a good rapport with are always a good person to approach if you're experiencing any emotions that feel like not very typical.
I imagine, like, I also often tell like my friends or even my patients that is probably the first pot, right? If you feel like something is happening with yourself or with your loved ones, like in this situation is your spouse, but it could really be any health problems with your other family members. I think your general physician is a really good first pot to kind of go to and have a chat, and it's helpful if it's someone that you've known for a long time, family physician. To just kind of figure out if you are, meeting any diagnosis or if you need any specific type of help. Talking to friends and family, I find that can be quite helpful because different people got different experience, but sometimes it's double-edged sword. Have you had those kind of experience? I've got patients who come in and tell me, okay, I told I had a panic attack, right? I told my sibling about that, and my sibling told me I was going to die, and then, oh my god, I got more anxious. I'm like, don't worry, you're not going to die. But so I think like speaking to the correct people is quite important.
So I think because sometimes people, laymen, maybe don't know the specific terms, and sometimes what they say can actually be quite invalidating as well, and they might unconsciously dismiss how you feel and what you think. And that might not help as well.
So what do you usually tell your friends and patients, how to support their like spouses who are going through perinatal, postnatal depression, anxiety?
So, like with any clients, actually, a safe space is very important. Sometimes it's not about solving this problem. Really, it's just lending a listening ear. Because that's what they need. A shoulder for your loved one to lean on, especially when they're struggling, or even just do fun things together. Just to it's a self-care, because it's very tiring carrying a baby and looking after a baby. After that, so self-care is very important, and sometimes we do neglect fun things.
Yeah, of course.
I think we are guilty too, right?
Yes, we are. No time for fun. But I was also thinking, like, in the context of, I'm just more thinking about the patients that I'm seeing. Sometimes I think helping them, like drawing some principles from cognitive behavioral therapy or like acceptance and commitment therapy, or even like compassion focused therapy, helping them understand where some of their unrealistic expectations about themselves or like from their family members, and helping to adjust those expectations can often have an impact on the way that they feel, and then subsequently how they respond, helping them kind of think a little bit more specifically about like what kind of values are important to them in terms of like parenting, and being like part of a team to welcome a child into this world, can be quite helpful to kind of inform the choices that they make, or really developing some compassion. I don't know about you, but I find that it's always very easy for everyone to have compassion for somebody else, but when we always talk about self-compassion,
It's very tough.
right? The tank is always very low. So I think some of these principles have been quite helpful, and I often tell like the people around me about maybe putting our minds to what's kind of within our control and what's not, right? Because sometimes it's really not about problem solving in that sense, because there are some things that you cannot problem solve. So I'm just more thinking in the context of some of my patients who have perinatal anxiety or depression. They may have received news that the child may be diagnosed with some kind of health condition, and they have to make a decision if they want to continue with the pregnancy. And that's a very difficult decision to make. Some of them might decide to persist and some may not. But it is what it is. The decision to persist or not is not going to change the condition, the health condition. And so kind of like putting our mind to what's within our control and what's not within, and also kind of thinking about what values guide our decisions, can help them come to a bit more acceptance of that decision and to prepare more logistically and practically in terms of the support that they will need to welcome this baby. Yeah.
I think on that note, someone told me before, don't know whether it's you, there's no right decision.
I say that a lot.
Right?
No right or wrong, right?
Yeah, no right or wrong.
Yeah.
Yes, there's no right or wrong decision. So it's a value, we need to consider our values when we make any decisions, and that's something that we usually explore with our clients.
I don't know. I also wonder, like, another aspect that we must remind everyone is to kind of work on the support, right?
Yes, so the support network is very, very important.
Yeah.
So as much as we say that earlier, right, when loved ones may or may not be helpful, but they can also be very, very helpful. And I always share with my clients that you don't have to share everything with just one person. Sometimes you can divide it, because not everyone can comfort you in the right way. So some things you can share with your best friend, not everything you can share with your best friend. Sometimes you need your husband and things like that.
Yeah, absolutely. So I always use the same analogy. I always say, in the context of thinking when you're younger, you have some party friends, right? Then these are friends that you go out and have fun with. Or when you're older, maybe the type of partying changes.
We bring our kids out together now.
Playdates, right? Yeah. And then, but then there are those like heart-to-heart talk kind of friends, right? Those that will be like the more like practical support type of friends. So kind of really going to the correct support will be helpful. Yeah. So I think that educating or like supporting the caregivers in the ecosystem can be quite helpful in supporting someone with perinatal anxiety depression or postnatal anxiety depression. So I always believe in this saying, it takes a village to raise a child. Don't even say children, say a
just
child.
one child.
But it's such a common saying. Then I always wonder, where is this village? Can you give me a telephone number to this village? Because I need this village. I don't have a village. And I always think back, how did grandmas and grandpas have like 7 children, 10, 12, and they were legit, they had a village, they had a kampong, and everyone was looking up. But now most of us come from nuclear families. We don't have a village. So one way is to kind of really build our village ourselves. And sometimes this village may not necessarily look exactly the way that you want it, because it depends on your expectations, right? Sometimes the village can give you more stress, right? So I've got patients who say, oh my God, when my children go to my in-laws, then they watch TV all the time, but then I don't let them watch TV. And so it's like the different types of parenting. So maybe think of a village, like whether it is through family support, then you need to manage your expectations, or like through paid help, through like even neighbors and friends like with similar ages, children with similar ages. But definitely build a resource, where you can kind of tap in and tap out, will be really helpful. So I find that, I'm really grateful that I can do what I do now, because I kind of more or less have some kind of village helping me. And I'm grateful because every member of this village teaches my children different things. Yeah.
I think what's also important is that we need to recognize that we are always the hardest critique of ourselves as well. So yes, the village is important, but at the end of the day also we need to think about ourselves. And what I would like to share with all mothers is that parenting is one of the hardest projects that anyone can take on. There's so much to do, so much to learn. And yes, you see, you need a village, right? What more yourself? And so I think what you really need is to be kind to yourself, and to take care and do a little bit of something that will do yourself a little bit of justice sometimes. I think we always forget that. As a mom myself, I also forget that a lot. There's a lot to carry, I know. Yeah. Actually, both of us know.
The emotional and mental load, right?
Even physical.
Yeah.
Right?
Yes.
How heavy are your kids?
Right. At this moment, 16.
Yeah. Okay.
16 kg.
Yeah.
It's like my gym. I don't even have to sign up for
I don't
gym.
need. Yeah. So carrying them is already literally very, very difficult. So what more? Everything else. Yeah. So yeah. mummies, be kind to yourself, even daddies too.
Yeah.
You need to support your the mummies, right? And I know that that's difficult because we can be very irritable too.
No, that's not me at all. No,
really not?
Yeah, no.
Yes. So we also still go through, PMS and things like that. So yeah. So,
And then especially if like all types of mummies, right? Actually, all types of mummies, all types of daddies, whatever the combination of the family type is, because they're different types of family types. It's not just a traditional family composition. I think as long as you've committed to having a child in whatever ways, right? I think you really just need to learn to be kind to yourself and just give yourself a pat on the back, because oftentimes I think we're caught in the doing, and we forget to like stop and just reassess how far you've come, how much you've done, and maybe just at least a little bit feel proud of ourselves for coming this far.
We hope you enjoyed this episode of PsychFM. Stay tuned for our next episode.